bit complicated. If you have a pain in your neck or have had a fall and injured your foot, where do you go for help? Do you go to a GP, a chiropractor, an osteopath, a massage therapist, or an acupuncturist? Stacy Irvine joins us now with the answers. Proud of you. It is so good to see you.
So good to be here.
It's very confusing for people. You know, something happens and you don't know who exactly you should see. So let's go through the list of healthcare practitioners that you might want to consider, starting with your GP, your general practitioner, or a pediatrician. What do they do?
Okay, so I like to think of them as kind of the quarterback of your team.
Right.
They're very important. I like to have the GP oversee kind of what all the other providers are doing. So a GP is great if you need any type of prescription and if you need imaging. So if you suspect that you might need imaging, I generally have people see their GP first.
Yeah, for me, that's usually where I start. Go to my doctor.
Yeah.
Chiropractor.
Chiropractor is a musculoskeletal expert. So they are very good in dealing with any type of chronic acute injury, also neurological type injuries. They're very experienced in those types of things.
Usually, would you get a referral from your GP?
You don't need one. No, you can go straight there.
Okay, all right. Physiotherapist.
So physiotherapist to me, so we work on a team. Like I work with physio, I work with chiro, I work with all these people. And physios to me, the ones that I work with, I really think are movement experts. So if I have a person that has an injury that relates to a little bit of problem with how they're moving, I like to send them with the physio out to the gym. They're also great with acute care. They're also great pre-surgical care because they have a lot of extra training in that.
They're amazing.
Yes.
Like never underestimate a physiotherapist.
Never underestimate that.
Now an osteopath is sort of a practitioner I have not thought of before. What do they do?
Not as common right now, but I think it's gaining steam and I think people are really seeing good results with them. An osteopath relies very heavily on very specific palpation skills. So they spend a lot of time palpating, seeing what the tissue, so hands-on. So feeling what the tissues feel like. Okay. And then making adjustments based on that, on their palpation and what they think it feels like.
So they're feeling, what are they looking for? Are they looking
for tissue changes. They're looking for things that might not be in the right spot where they think, you know, it should be feeling, how the consistency, maybe the blood flow, those types of things.
Okay, all right. Registered massage therapist. I know
all of our favorites. So,
they're so good.
Yes, we were discussing maybe we should just do a massage today.
For 6.5 minutes.
We all love it.
The entire segment.
It is a wonderful thing, wonderful for recovery, wonderful for prevention. A lot of the athletes that I work with, I want them to have regular massage treatment. I think it's fantastic, and I think it's something that we should all try to do a little more frequently. They are a tissue expert, so again, they're going to feel and see what's tight, what's not moving the way it should be, and they're going to work on that.
If you are in any kind of line of work that is repetitive, all of our camera operators, desk jobs, my makeup artists, anything where you're doing the same movement again and again, it should be a regular part of your regimen, right?
It should.
Oh, and it feels good. Acupuncture.
Acupuncture, so that's with needles, and they're putting needles in specific anatomical points in your body. They're causing an endorphin release that is very good for dealing with pain especially. I love acupuncture for people who are in chronic pain, and if sometimes they can reduce some of their medication and instead do acupuncture, I think it's fantastic.
We are definitely moving in that direction. I think that the population that has relied on pills for a long time is realizing there's other ways to do this.
There's other options, which is really nice.
I'm going to throw some conditions at you.
Okay, I'm ready.
You tell me who I need to see.
I'm ready.
Okay? Ankle sprain in a child with lots of swelling.
Okay, so in a child, lots of times they don't give us good information. So some children will completely overreact, and some children will be like, oh no, it's no problem. So I always say that if there's lots of swelling and they've had an acute injury, I want to get an x-ray eventually. It doesn't mean you necessarily have to go to emerge, but I would go to their pediatrician, maybe even, you know, the next day when you have time, call and get an appointment, because even if I'm treating it, I'd like to see an image.
Yeah, I get it.
Yeah.
I get it. Acute shoulder pain after a day of heavy lifting.
Okay, so this is interesting. So we know the cause.
Yeah.
When we know the cause, sometimes we can feel a little bit better and you know, okay, this makes sense why I have this. So for that, I would say chiropractor or physiotherapist, because we want to get to the root of it. Okay, so a massage therapist would make it feel better, but we also need to figure out, why is my lifting technique causing me shoulder pain? So we want to understand that, so chiro or physio will do that for you.
Chiro or physio, good. Chronic upper neck pain and tightness.
Okay, so this is where your massage therapist comes in, osteopath, or possibly acupuncture. Some people get good results with that for acupuncture, but definitely massage. My first go-to for that would be massage.
If you go to a clinic like your clinic, you almost have it all in one. So,
we do.
Because a lot of time physiotherapists will say, I'm also going to give you some acupuncture. We're going to do a little bit of everything here.
These days, the team works to your advantage always, and much more clinics are going that way, where they have all these people together, and that's the key. The person on your team should always refer. If I'm not getting good results, I should be confident enough to say to you, oh, I'm not sure, like my skill set is maybe not good for what you have. I'm going to refer you to this person on my team. They're an expert in whatever you have. So you always want to find a provider that is happy to refer you to someone that they are comfortable with. It's 100%. Very important.
Migraines. Where do you go for migraines?
I do acupuncture or osteopathy.
You would?
I would, yeah.
Okay.
Yeah. Acupuncture can be amazing for migraines. And then again, you're reducing all the meds that you have to take sometimes for them, because they're very debilitating.
Arthritis in joints? A lot of our viewers suffering from this.
Yes, this is such a common ailment. Last month was Arthritis Month, so it's important that we're talking about it. We want to keep moving with arthritis. So acupuncture has proven to be very good for the pain relief of arthritis.
Good.
And then I would say physiotherapy, because you want to keep moving, but you got to know how to do it properly.
Yes.
So you want to be out in the gym doing your exercises, but you need to do them perfectly so you don't inflame the arthritis.
Ah, okay, so you're moving through the pain.
You're moving through the pain and trying to manage it as best you can.
Got it. Oh my gosh, these are so good. So I hope we've given you something to think about there. Stacy, thanks for that.